Well, I can maybe start with introductions as people start to join in here to Grand Rounds. My name is Mary Charlton. I'm an associate professor in the Department of Epidemiology and co-leader of the Holden Comprehensive Cancer Center Cancer Epi and Population Science program. I'm also the, I guess not newly anymore, but president of the Iowa Cancer Consortium. So I'm very excited to introduce two of my favorite people out there. Kelly Wells Sittig and Rachel Schramm, who are going to talk about the cancer plan and how it can play into catchment area research that we do for Holden. It's certainly the current R01 I have right now that assists community cancer centers across the state to help improve their quality and comprehensiveness of care would not have been possible without the consortium and the connections that these folks have with people across the state. And it just really helps to engage people all throughout our catchment area, whether or not they come in through the doors of Holden or not, into our research. So I'm really excited that everybody's here today to watch this. Starting with introductions for Kelly. Kelly Wells Sittig is the executive director at the Iowa Cancer Consortium, which is a comprehensive cancer control coalition of nearly 600 Iowans and 65 organizations working to reduce the state's burden of cancer. Kelly has more than 15 years of nonprofit experience, including 10 with the Cancer Consortium. She also serves as a co-lead for community outreach and engagement at the Holden Comprehensive Cancer Center. Kelly's educational background is in public administration, music, and organizational psychology, and her areas of expertise include facilitation, coalition building, organizational development, and communication. She loves the energy that develops when people work and problem solve together around issues they're passionate about, and believes that positive interpersonal, team, organizational, and community dynamics are important ingredients for better collaborative outcomes. Then on to Rachel Schramm. She is the program manager at the Iowa Cancer Consortium. She has over a decade of experience in the field of public health and has worked for the Iowa Department of Health and Human Services, formerly IDPH, and also Linn County Public Health on things like walkability, chronic disease prevention, public health communications, and disaster preparedness. She recently completed her 5-year term as board member for the Iowa Public Health Association and as communication chair for Iowa Immunizes. Rachel's degrees are in kinesiology and community development from Iowa State. We'll forgive you for that, Rachel. Just kidding. So anyway, we're so excited to have you guys here today, and I'll let you take it away. Thanks.
Thanks, Mary. Thank you for the really warm welcome. We are very excited to be here. I'm going to share my screen and someone can let me know if it doesn't look right. Again, thank you so much for inviting Rachel and me to present today. Looking across the virtual room as we get started, that we have a lot of really familiar faces, which is wonderful. So thanks to those of you who already know a lot of this for coming to show support. And I also, I think of those of you who are familiar as ambassadors for everything that we're going to talk about today, which of course, as Mary said, and as you all know, because you're here, is how the Iowa Cancer Plan and the Iowa Cancer Consortium can serve as tools for catchment area research. Rachel and I have 3 objectives that we'd like you to take away today. So we hope that by the time we're done today, that you'll be able to define comprehensive cancer control and talk about what the Iowa Cancer Consortium is. We also plan to talk about the ways that the Iowa Cancer Consortium has engaged partners over the last couple of years from across the state to develop a community-informed cancer plan, which is, of course, the Iowa Cancer Plan. And then we hope that you'll come away with some idea of how researchers specifically, but really anyone with a stake in cancer control can engage with the Iowa Cancer Consortium and use the Iowa Cancer Plan to support, enhance, and inform catchment area research. So I know the title of this presentation is focuses on the Iowa Cancer Plan, but we are going to do a little bit of a Cancer Consortium 101. In putting this presentation together, Rachel and I really realized there is no Iowa Cancer Plan without the Iowa Cancer Consortium, and vice versa. They really go hand in hand. engagement threads throughout. The tools and resources we're going to talk about and the ideas that we're going to suggest really are related to both and can't be considered in isolation. And just so you know, we do plan to leave about 15 minutes for questions, so we hope you'll have your questions ready. We love to talk about the work that we do, so it would be great to have a wonderful conversation when we're done. The Iowa Cancer Consortium is our state's comprehensive cancer control coalition, which is a mouthful and a brainful. It's a lot to understand and dissect. So let's talk about comprehensive cancer control. You might have heard, most likely have heard this thrown around a lot. And what this simply means is that comprehensive cancer control is a collaborative process, emphasis on collaborative, where the community combines resources to reduce the burden of cancer by working to prevent it from occurring, find it in its earliest stages, improve the accessibility, availability, quality of cancer treatment services and programs, and really enhance the optimal quality of life for people impacted by cancer. And it involves addressing cancer from all parts of what is known as the cancer continuum, which is what you're seeing here on your screen. And this, of course, includes incorporating health equity throughout the continuum in an effort to reduce health disparities. I'm sure that we are all here today because we care about cancer and cancer outcomes in Iowa in some way, even if our perspectives are all different. Our work is all different. But if you look at this cancer control continuum, I am sure that you will find your work or some representation of yourself and your efforts here within the cancer control continuum. It's very fast, all-encompassing, and it shows how much of a challenge reducing the burden of cancer can be because of all the moving pieces. And it really does take all parts to really change cancer outcomes. We need community health workers who are embedded in communities and helping their neighbors navigate the health system. We need public health professionals who run screening programs for Iowans who otherwise wouldn't have access. And we need researchers, of course, who are developing cutting-edge treatments and examining how to change health outcomes in populations. And this is really the heart of comprehensive cancer control, that we need everyone working together from across disciplines and communities and experiences to really reduce the burden of cancer. As you can imagine, that can be a really difficult thing to explain to a person who's not familiar with cancer or cancer control. And we even joke over on the Cancer Consortium staff that it can be very difficult to talk about what we do. So we like to start with this really simple statement. And I think it is understandable to everybody on this session. Cancer is a complicated and costly disease, and addressing it is difficult to do alone. And I would say impossible to do alone if we really want to have positive outcomes. And that is where the Iowa Cancer Consortium comes into play. As Mary mentioned, we are a network of nearly 600 professionals and advocates from across the state who are working together to advance cancer control in Iowa through advocacy, equity, and collaboration. Now, I want to make one note. It's likely that you all have heard about catchment area for the Cancer Center. And of course, the catchment area for the Holden Comprehensive Cancer Center is the state of Iowa. And I think it's significant that, of course, that is also the service area for the Iowa Department of Health and Human Services, who we'll talk about a little bit, and for the Iowa Cancer Consortium. I also want to mention that the mission of Holden is to reduce pain and suffering caused by cancer in Iowa. The reason I mention this is because as we go through our conversation today, one thing that's important to keep in mind is that our missions really align. So we are all working towards the same thing ultimately, whether we're talking about Iowa HHS, whether we're talking about the Iowa Cancer Consortium, whether we're talking about the Holden Comprehensive Cancer Center. We are all trying to make cancer-related outcomes better for Iowans. So I mentioned that the Iowa Cancer Consortium is Iowa's comprehensive cancer control coalition, and I'd like to tell you a little bit about how it came to be and what it even means to be a state comprehensive cancer control coalition. So for more than 20-ish years now, states, as well as many tribes and territories, have been mandated by the CDC to have what we like to call the 3 Ps. And this stands for the Comprehensive Cancer Control Program, a partnership, and a plan. Typically, states receive federal funding from the CDC, and then in turn, the CDC requires that these 3 Ps be carried out within the states, tribes, or territories. Every plan is unique to each region, as is every partnership. The plans are typically, as Rachel will talk about, based on data collected about the people living there and are renewed every 5 years. The cancer plans incorporate strategies that have worked either in that region, state, or a similar place and turn them into a blueprint for action. And that's going to be our focus today, is the plan. But I also want to tell you really quickly about the program that is housed in what is now Iowa HHS and was previously at the Iowa Department of Public Health, or IDPH. They are our main funders, and I'll explain that a little bit here, but they're an important comprehensive cancer control partner. And so they are a member of the partnership. And the partnership, that 3rd P, is the Iowa Cancer Consortium, which was formed in 2002. We published the first state cancer plan in 2003, started receiving state appropriated dollars in 2007, and became a nonprofit in 2008. If you think Iowa Cancer Consortium is a mouthful, we were first known as the Iowa Consortium for Comprehensive Cancer Control, but today we're doing business as the Iowa Cancer Consortium, convening Iowans and building capacity for implementation of the 2023 Iowa Cancer Plan. So we've been talking about how we're a coalition of almost 600, and I think that by the time we hit June, I think we'll probably be there. As of yesterday, we are a coalition of almost 592 cancer control professionals and advocates, including 64 organizations who want to work together to reduce the burden of cancer in our state by formally aligning with this partnership. Cancer Consortium members are healthcare providers, administrators, public health professionals, researchers, survivors, advocates, and more. If you think back to that cancer control continuum and all the different industries and professions and areas of interest that are included in that continuum, we have representatives from all of them. It's a very vast, very diverse coalition or network. And it includes, at this point, I think around 30 people from the Holden Comprehensive Cancer Center, and which is wonderful because as the state's only designated cancer center, you all are an incredibly important partner in comprehensive cancer control within the state. And this is also where I get to tell you that if you're not an Iowa Cancer Consortium member, that Dr. Henry has agreed that the Cancer Center will pay for your Cancer Consortium membership. So we'll leave some contact information with you today. And if you're interested after we're done talking and joining the Iowa Cancer Consortium, we would love to make that nice and easy for you. And a big thanks to Dr. Michael Henry for making that possible. So it can be really helpful, probably by now you're already understanding that the consortium is a complex beast, and it can be really helpful to just see how the consortium is set up in order to understand it. And I think, especially from a Holden Comprehensive Cancer Center perspective, you all are probably also, hopefully, hearing a lot about community outreach and engagement. And it can be hard to understand where the consortium starts and stops, where community outreach and engagement maybe starts and stops, where they overlap. And so I offer an explanation here of the consortium structure in order to help with that a little bit. So I think of us as a triangle, which is a strong structure, right? Like we know that triangles and pyramids are some of the strongest structures that exist. And there are really three components that make it possible for us to do what we do. One, as mentioned, is the Iowa Department of Health and Human Services, or Iowa HHS. And we are so lucky here in Iowa to have state appropriated dollars from the legislature to support comprehensive cancer control. And then the program, Iowa HHS, also receives some CDC funding to run the program, run the partnership, and produce the plan. And so we get a competitive, we being the nonprofit, the 501c3 there in the middle, we get a competitive 5-year grant from Iowa HHS. And I'm going to show you here with my cursor, hopefully you can see that. So the nonprofit receives this grant. We also have some income from membership dues and sponsorships. We take some of our grant funds, subcontract with the university to pay our staff salaries and benefits. So we put that money to the university and get it back in the form of salaries and benefits for our staff. So what that means is that our permanent staff are staff of the University of Iowa Holden Comprehensive Cancer Center. So we're housed here, we're in the HR structure, and it also means that we have the ability at times to serve on grants and through other funding to support initiatives at the Holden Comprehensive Cancer Center that align with the consortium's mission. So I've listed an example here. Mary mentioned that in addition to my role at the consortium, I'm able to serve about 17% of my time on the community outreach and engagement team at the Cancer Center. So it's a really wonderful, strong structure. It's unique, it's complicated, but it serves us well. And it serves Iowa well. In addition to all plans being different, all partnerships are different, Iowa is really unique. I don't think there's another state coalition that is just like ours. Most of them are different. And our structure works very, very well and is recognized in the country. We get a lot of interest from other coalitions in terms of how we're able to maintain that stability. And we certainly tell them that it's through the partnership of Iowa HHS, of course, our members and partners, and then the Holden Comprehensive Cancer Center. So the consortium, as we're talking about today, is a partnership entity, right? And we have established relationships to communities and community partners in Iowa who are consortium members. They serve on our board of directors, and they participate in several statewide work groups and committees. And that's really what I want you to take away from this screen. If you look at our work group list here, one of the ways that we promote community-driven cancer control is by pulling together partners from across the state. So this is one of the best ways to, in a way, get outside of Holden and start meeting people in your interest areas who are working with communities, who are in communities, who may have different perspectives on topics than you have, or may have different resources or access to different partnerships or different knowledge. And so right now we have groups convening around cancer screening and early detection, health equity, HPV, policy, radon, research and clinical trials, rural cancer control, and quality of life. And then we also, over the past couple of days, have been chatting with Dr. Charlton about starting some discussions around potential environmental relationships to cancer. So hopefully you're on our email list. If you're not, hopefully you're a member. But if you're not, I would definitely encourage you to at least sign up for our email address and we'll get you that link. our email list so that you can stay up to date with what's happening there. So in addition to work groups, there are other ways that our staff, our board and members make community partners and partnerships work for the state. So our staff is doing nonstop partnership building and matchmaking. We are gap filling through communications, through, again, gap filling through connecting people who might not otherwise be connected. We offer implementation grants based on the Iowa Cancer Plan. We pull people together through conferences like the Iowa Cancer Summit and our spring meetings. And we offer other forms of capacity building and storytelling, which I know Rachel will talk about a little bit. I also just want to point out the diversity of our board of directors. This is something I'm really proud of, and I hope our board and our membership is really proud of as well. You'll recognize some names up there. Of course, Dr. Charlton currently serves as our board president. Dr. George Weiner is our immediate past president and one of the founders of the consortium. But our board also consists of cancer survivors, community health worker representation, public health professionals, administrators, oncologists from other cancer centers in the state, and more. And I think this really speaks to the fact that above anything else, the consortium is a network full of diverse perspectives from across the state that is this wonderful, warm partnership platform that is available to anybody interested in comprehensive cancer control within the state. So thanks for humoring me and sticking in there while I tell you about our complicated organization. And now I'm excited that we're going to get to tell you about the Iowa Cancer Plan. Our most recent version of the plan comes after a long line of other 5-year plans. However, this one is unique in that it's the first that is available only online, of course, to reduce paper waste, to reduce the cost associated with shipping the plans across the state. But it also allows our organization to update the plan more often and as needed, and it allows for the plan to be accessed by folks of all abilities, which is really important to us. The cancer plan is at the heart of what the consortium does. We ask all community grantees to align their proposals with the cancer plan. It also serves as a guide for implementation activities and helps provide context for making key decisions for populations and communities interested in reducing the burden of cancer. And finally, the cancer plan casts a shared vision for our state, which helps us build momentum and energy around different cancer control issues that are brought to the table by our partners. So my colleague Rachel Schramm, who's been introduced and who oversaw the revision of the plan, is going to tell you more. Rachel?
Great. Thanks, Kelly, and thanks to everybody for being here today. We get really excited about the cancer plans, so we hope that you do too. But yes, today I have the privilege of just sharing with you some basic information about how the recently revised cancer plan can be used and how we incorporated community engagement throughout the process. So you'll find in the chat, there's a link to our website, cancerio.org, where you can just look around the plan as we're talking about it a little bit. So just painting with a broad brush here, the Iowa Cancer Plan has 5 main chapters, and that also spans that cancer control continuum that Kelly was talking about. We have health equity, a chapter on prevention and risk reduction, early detection and screening, diagnosis and cancer-directed therapy, and survivorship and end-of-life care. So if you're on the website now, you can just use that simple navigation menu on the left side of the screen. And we hope that Iowans are able to easily navigate through the chapters of the cancer plan and topics based on their interests, but also be able to kind of find places where they're really passionate about and be able to dive a little deeper. So here I'll show you some examples. So we know that lung cancer is one of the top causes of cancer mortality in Iowa. So I thought maybe this might be a good example. Under the prevention and risk reduction, we can see that there's 8 different priority areas listed under that. And of course, that includes everything from tobacco and secondhand smoke exposure to things like opportunities for physical activity and access to nutritious foods, decreasing alcohol consumption, talking about, important cancer prevention vaccines. So now we're drilling down just a little bit further, and you can see some examples of just specifically this one about tobacco, preventing initiation of tobacco and nicotine use, especially among youth. That's kind of like an overarching strategy to kind of outline the work that we do, but we also include action steps. So those little bullets, and those are things that we hope that cancer centers, that advocates, that schools can look at that and say, you know what, like maybe that's my piece of what I do for cancer control in Iowa, and let me figure out a way to put that into play. So Kelly, I think I did a couple more animations on this slide. I think I got real excited, but you'll just see, if you would scroll through here, you'll see other strategies related to kind of that tobacco piece, and then also resources that we use and encourage our folks to use. All right, so on this next slide is something really interesting as well. In making the cancer plan online, we knew that we really wanted to incorporate a strong data presence, but we had to kind of make it so that it was easily understandable for the average Iowa citizen, but also for people like researchers that they could also dig in and get more information if they wanted to. So this is really new for us, but with the help of the Iowa HHS, we were able to use the software called Tableau, where these different graphs and metrics can be updated in real time. So they do it, on their end at Iowa HHS, and it actually comes to our website and updates automatically. But what's really neat is that it includes, so not only Iowa's specific rate. So this is for the percentage of adults currently smoking cigarettes in Iowa. So the big blue box shows Iowa's current rate, which is about 16%. The spot in kind of the tealish greenish color is our target. And that's based on, we did a variety of things throughout the plan, but either on an Iowa HHS measure that they outlined, or a Healthy People 2030 target. But one of the things that is new for us with this cancer plan, and that we're really proud of, is that if you kind of hover over the different data bars, it'll actually show you broken out by subpopulations where some disparities exist. So, if you were someone working at a local health department or something, and you wanted to see, what subpopulations are above Iowa's average, you could see from this chart that, potentially focusing on the LGBT community and messages for them would be super important. Focusing on the uninsured or folks with a disability. So we're hoping that people can be data informed, but also use this as kind of a creative process to really figure out what they want to do in their own communities. All right. I guess before I kind of go into some examples of how we really engaged our community to create this, I just wanted to share that when our team was originally sketching out what we were going to do, it was going to be a year-long process. We knew there were going to be a lot of minds and hearts involved. But I think one really important lesson that we learned from the get-go was that this would be an exercise in vulnerability. So really just knowing that as we look at the state, that there is a certain level of uncertainty, risk, and emotional exposure, as we went out to our partners and said, hey, we're experts in cancer control, but we're not necessarily experts in biomarker testing or genetic counseling. So just being able to, we've built a lot of trust throughout the last decade with our members. So just being able to reach out and say, hey, Caroline, I know that you have a lot of expertise in this. Could you look at it for us and help us out? That was something that was incredibly freeing, I think, for me, just knowing that we didn't have to do the whole thing on our own. So we did send out an email to members right away and just said, you know what, here's 3 things that you need to know. We're updating the plan, and it's all our collective responsibility. We liked our last cancer plan. Members liked the way it was organized, but we knew that we had a couple things that we did need to tidy up. We asked for reviewers or topic experts who would self-identify and let us know what they were interested in. And we also had kind of teased that there might be some new topic areas that we were going to add to the plan, and we really needed our members to come out and help us with some of those things. So like childhood cancer came up, environmental health, disaster preparedness, that sort of thing. So from the get-go, we established that open line of communication right away. I won't go too deep into this slide, but if anybody wants to contact me, I'd be more than happy to talk about it. But in my previous roles, I had worked for a larger county organization and for their community health improvement plan, where they worked with hospitals. They utilized just a framework that's called mobilizing action for planning and partnerships. And this was from the National Association for City and County Health Officials. So what we decided to do was that we would kind of take this framework and take what was good out of it and apply it to cancer control. So you can see kind of in the center is like what the, the traditional, like, asking the community what they think, hosting meetings, like that sort of thing, but kind of like hugging it are these 4 arrows on the outside. And those are all about kind of assessing like the environment in which health happens, what the health of the population is, and kind of like what are some potential like facilitators and barriers within the environment that would maybe change the health of the community. You can go to the next slide, Kelly. All right, so just as far as feedback strategies, one key pillar, and I know there's a couple of folks on the line today, was developing kind of like a community advisory board. So we called it a steering committee, but it was really just Iowa Cancer Consortium members who we knew that we could count on to kind of see through a variety of different lenses. It was very important to us that our committee reflected the diversity within Iowa's communities. So we really did take that to heart as we move through. Obviously, looking back, I think there's things that we could have done better or different, but I think that's part of that learning process. But they were really tasked with the oversight and the creation of the new cancer plan, including the planning, evaluation, and feedback process. So in the next couple of slides, I'm just going to show you some examples of kind of inputs into the plan, I guess. So we did use a variety of data sources to create the plan, both national and state sources for cancer specific data. And that included a lot of emails and calls to our friends at the Iowa Cancer Registry. So those are there. And then I was going to say, we really had to focus our strategy to make sure that we were communicating out, that we weren't like keeping in everything and, holding it until the whole thing was all done, but really like pushing out email messages on social media, asking people to share with their coalitions to really make sure that we were really digging deep and had the feedback that we need. We did also offer a variety of input mechanisms because this was the first time that we updated the state plan in a pandemic, which was super new. So everything was online and we really utilized Google, the Google suite a whole lot, but just things like we didn't really do a lot of like, I guess for new topics, we kind of held like new like webinars and stuff like that to kind of talk about those topics. But otherwise, we really just folded it into existing things that we had going on, like membership meetings, our different work groups, and like I said, our topic experts. But everything happened in Google Docs, the whole thing, which was pretty wild looking back on now. But here's a couple of screenshots of just what we did. Again, if anybody has questions, I'm happy to answer these. But our online form, we just asked in a couple of sentences, describe your edit. And this is just an example of some of the feedback that we got. We did have a couple of like new topic areas that came through. So this is an example, childhood cancers was defined by the membership as really missing from the last plan that needed to be included. So we were lucky enough, we actually had a graduate student who was able to do her practicum project with us. She focused her work on childhood cancer data collection with the registry, but then also held a series of like discussion sessions where she was actually able to, meet with parents, parents of kiddos who are experiencing cancer and providers to really talk about like what we wanted to include. And just an example of kind of what we learned through those discussions was that, the term childhood cancer was too broad and really needed to be broken down. So from that sort of feedback, we were able to say, okay, like this is what we're going to say is pediatric and childhood cancers. And now we're going to make kind of like a new section just for AYA specific cancers. And just a screenshot here, we used a tool on Google called Jamboard, which is basically just like a big sticky wall. And virtually folks could in real time see all the comments that were going up. So we'll have a couple of those here. The next slide, we have our annual meeting. So this is the spring meeting. Just an example from our environmental health breakout room. Again, we asked, what should be changed, if anything, if it's not a new topic, and what are the largest obstacles that you see facing those issues? And then we also had asked, like, what other recommendations or suggestions do you have? The next slide, Liz on our team had a really good idea to just do a specific survey to work group members. So if folks weren't able to attend the virtual meetings, that their feedback was still important and collected. So this is just an example of a survey that was done. Similarly, this is one of my favorite things to do was these expert reach outs. And I did put an asterisk by every person from the University of Iowa that we contacted because it was a lot of people. But really it was us saying like, here's the draft of what we have. Like, what do you see as missing? Like, what's the new information out there? Can you, if there wasn't like an existing population health metric to kind of say, could you help us come up with these? But these teams were just like incredibly helpful. And I'm so thankful that we had their brains because it made our plan a lot better. And then just something I wanted to point out was just kind of the buy-in across institutions. So we did receive letters of support that we would normally print out, but they are on the website. So Mary Charlton, as president, provided her letter of support. And then we also had a letter of support from Governor Reynolds and from Iowa HHS Director Kelly Garcia. Let's see. I think Liz is going to put it in the chat, but we did our experience of working with communities and policymakers, there is really power to a story. So we did use funds to hire a video production company and we helped identify partners at every different chapter of the cancer plan. And we really wanted to focus on like real Iowa stories, what was happening. So these videos showcase some funded projects, some cancer survivors, that really just spans that whole continuum. Each one's about 4 minutes each. So if you have time, I would really encourage you to check those out and share them with who you think is appropriate. And we're planning to do more. So if you have a story you want to share, do that too. So I guess the last thing that I just wanted to talk to you about before I turn it back over to Kelly is just kind of how researchers can really like engage with the Iowa Cancer Consortium and the cancer plan to support the work that you do. So first, we think that we're going to be able to help you respond successfully to new NCI and other funder requirements that addresses disparities. Rightfully so, more and more funders are really looking at the research that happens, like how is the community going to be integrated or engaged in that process? And so we definitely want to encourage you, if you haven't connected with your Holden COE team yet, please do that. So that's Dr. Natasha Askelson, Dr. Sarah Nash, and Megan Schmidt. They will help you. They're helpers. They're there to help. And we also think, obviously, that you can use the cancer plan because it was developed by partners across the state, across your catchment area. And so it really can help you identify those priorities. Next is to identify research areas or areas of need. I just wanted to share a couple of areas that are like absolutely new to our state cancer plan, our pediatric and AYA cancers, exposure to environmental carcinogens, ovarian cancer, awareness and education, biomarker testing, and Hep C testing. Similarly, we did add a couple of new overarching themes. So really just honing in on how do we as a state provide more affirming cancer care. Also incorporating action steps focused on disaster preparedness. So let's say a derecho happens again, or a flood or a pandemic, like how are we really focusing on that continuum of care for cancer patients? Similarly, just like centering in those communities and research wherever possible, and then the investments that we really need to make as a state to enhance the diversity, equity, and inclusion efforts just around the spectrum in general. Next, we think that we can help you connect to existing community engagement opportunities. So we primarily focus on connecting experts, professionals, and advocates working in the community. And so we're happy to send out that warm email or, listen to what your pain point is and see if we might be able to connect you with a member. Otherwise, your COE team is always there as well. We have ways that you can disseminate your research findings to a cancer control audience, especially if they're related to the cancer plan, which nearly everything is. But we have just a variety of clinicians or researchers that have presented at work group meetings, write blog posts on our website that appear in our newsletter that goes out, or like I said, do kind of that warm email introduction. We have ways that you can listen to communities across the state without ever leaving your desk. So through some of our work group meetings, you can hear what's happening at a cancer center in Carroll, Iowa, just by being there or receiving the meeting minutes. I would say like a kind of a new area for the consortium, I think, would be just like really making the case for additional resources, whether that would be professionals like genetic counselors or lung cancer screening programs, or the need for additional providers or specialists. By hearing the stories across the state, I think we're able to kind of see problems maybe before they happen, and marrying that with the data that the registry has, it's kind of easier to make a case for some of those needs. And then similarly, just turning research into policy. Time and time again, we've had clinicians and researchers who've said, talking to legislators like isn't my bag. Like I just don't really see myself doing that. Who have like slowly gotten involved with the consortium and different partners, and have really grown to be wonderful advocates for cancer control efforts. So Kelly, I might turn it over to you to just provide some Holden specific examples.
Yeah, thanks, Rachel. Yeah, I've got 3 examples that I want to share with you today. So again, I know this can feel fairly abstract when you're dealing with so many people and different types of people, and this idea of community outreach and engagement itself can feel very abstract. So I hope that these examples will help solidify some ideas in your mind. But again, I can't stress enough. I encourage you, if you're intrigued after today, I can't encourage you enough to reach out to the community outreach and engagement team at Holden and to us at the consortium, but definitely start with the community outreach and engagement team, because they're there to help you navigate these waters and figure out how your research might apply to community and what that might look like. These examples I have for you are work that has involved folks at Holden, but also had components that are heavily supported by the Iowa Cancer Consortium and the Iowa Cancer Plan. Rachel just mentioned policy, and one of the most complete examples that we can share about the full circle of community outreach and engagement and research resulting in policy. Of course, I'm sure many of you are familiar with this, but it's the development of Dr. Bill Field's radon research at the University of Iowa at Holden, and the resulting policy change at the state legislative level. So Dr. Field, of course, he was one of the world's leading radon researchers. But his work wasn't limited to the scientific literature. About 10 years ago, we were very lucky, Iowa was very lucky to have a really magical combination of Dr. Field as a world-renowned radon researcher, plus a fiercely passionate survivor advocate named Gail Orchett, who is a consortium member. We also had a strong relationship with the American Cancer Society's lobbying arm, ACS CAN, and then of course the consortium, who was available to convene and sustain partnership between all of these players, as well as bringing more to the table. So for 10 years, and let's all keep in mind, a lot of this is not something that we can just do instantly, right? Like community outreach and engagement, community informed and engaged research, being bi-directional in our communications and our work with communities. This is a long game. This is not a one and done. It's not we can complete this in a year to check it off our list. This is a long game. So over about 10 years, all of these players worked together in a lot of different forms. So they met via an Iowa Radon Coalition. Legislation was introduced multiple times and failed. Partners had implementation grants, but they just kept persisting. And in 2022, the Gail Orchett Radon Safety in Schools bill was passed at the state level, and that requires Iowa schools to test for and mitigate for radon if needed. And that really was based foundationally on Dr. Field's research. And his work also influenced multiple iterations of the Iowa Cancer Plan, including this one in 2023. So another example that I'll share with you, it's a little different. In 2015, for those of you who know Dr. Stephanie Gilbertson-White, she received a small concept grant from the Iowa Cancer Consortium for work that was supported by the Iowa Cancer Plan. Her focus was on obtaining stakeholder input on the development of a web-based telehealth program to provide symptom management support to patients with advanced cancer. And so based on this grant work with the consortium, she was awarded 2 years of funding from the National Palliative Care Research Center to evaluate the feasibility of using her Oasis web app in conjunction with the Holden Comprehensive Cancer Center and UIHC eHealth and eNovation telehealth technologies. Since then, she's partnered with Dr. Aaron Seaman, and you'll note a quote from Dr. Seaman at the bottom of the screen as well. He's an important partner of ours as well. So she's worked with Dr. Aaron Seaman and ICTS to move the work to a mobile app. She's received funding from ACS Theory Lab to engage AYA stakeholders. To refine the intervention. She's received funding from the Betty Irene Moore Foundation for nurse faculty leaders and innovators to develop and test a functional mobile application. And she's also has a proposal under review to the Hillman Foundation and has been invited to submit a proposal to Innovations in Care grant, which is under review to test the efficacy of the Oasis app in rural and non-rural people within the cancer continuum across Iowa. So obviously, we're not going to say that this all happened because of the Iowa Cancer Consortium, but we're so thankful that we could be a partner, and I do hope that it has supported that work. The consortium has continued to write letters of support for Dr. Gilbertson-White's and Dr. Seaman's research, and their progress has been disseminated through the consortium network supported by the Iowa Cancer Plan. And I'm sure they would be happy to tell you more about their work if you're interested. And then finally, of course, Dr. Mary Charlton's work supporting small and rural Iowa cancer centers to improve the comprehensiveness and quality of care for rural patients has been closely intertwined, as she referenced, with the Iowa Cancer Consortium. So together, Dr. Charlton, Dr. Anjali Deshpande, community partners throughout the state of Iowa, and the consortium have launched a sustainable rural cancer work group that's housed at the consortium. We have all shared partners and resources to strengthen this collaborative infrastructure of rural cancer control in Iowa, led by Dr. Charlton's research. Her work, of course, is supported by and continues to inform, again, there's that bi-directional idea, the Iowa Cancer Plan. And so we threw a little picture in here of Dr. Charlton and her co-chair of the rural work group, Lori Sittig, who is the Cancer Services Director at St. Anthony Regional Cancer Center in Carroll, Iowa. And last year, the work group received the National Organization of State Offices of Rural Health Star Award on National Rural Health Day. So those are my examples, and I'd love to tell you more, and I'm sure the folks involved would be happy to tell you more, but I just want to like end us here with 3 kind of takeaways. So if you remember anything, remember this. The Iowa Cancer Consortium and the Iowa Cancer Plan offer you as researchers a path to community relationships and priorities, community identified priorities for enhanced and informed catchment area research. The consortium is there. We keep relationships warm. We build the relationships. It is available for your engagement, and your engagement is needed in addition to community engagement so that we really can reduce the burden of cancer in the right community informed way. And we're here, and we're housed at the university, and we would love to have you join us, and we would love to support you in your work. I want to just emphasize something Rachel said too. This is not only the right thing to do, like think about community engaged and community informed research and how we are being bi-directional, how we're disseminating research, how we're informing it, and how we are working with community, but is being required more and more by funders like NCI. And that leads me right into the last takeaway is that if this feels overwhelming, or if you're interested but don't know how to get started in hearing and listening from the community, or you're a little cautious about getting engaged with the consortium, start with the Holden Comprehensive Cancer Center Community Outreach and Engagement team. And of course with us, but the COE team is there to support you and to help you find the right way to engage with community for your research, including maybe through the Iowa Cancer Consortium and in support of the Iowa Cancer Plan. And then the last thing I'll tell you before we open it up for questions is that for those of you who are attending the Holden Scientific Retreat on June 14th and potentially submitting a poster, hopefully you've seen that the Iowa Cancer Consortium is offering a small poster prize that will consist of some consortium swag, and we have the best swag, but then also a gift card as well for the poster that best integrates the Iowa Cancer Plan. And so that is it. Here's our contact information. We'll also drop these in the chat. We also want to just give very big thank yous to our partners at Holden. Again, Holden is an incredibly significant player, obviously, in the cancer control community in Iowa. And so to Dr. Charlton, to Dr. Weiner, to everybody we've mentioned today, to the community outreach and engagement team, to everybody who's involved in the Iowa Cancer Plan revision process, and to our 600 members across the state. It takes a village. We're lucky to have a really strong village. And so just a lot of gratitude to that group. And I'm going to stop sharing my screen so we can answer some questions if there are any.
Thank you so much, Kelly and Rachel. We really appreciate it. Don't see any questions in the chat yet. Does anybody in the audience have any questions for them?
So Kelly and Rachel, maybe first of all, thank you for a spectacular presentation. How can you work with basic scientists in the Cancer Center who tend not to think as much about the community impact of the research when in fact it's hugely important?
Yeah, great question. I don't know that there is one answer. I'll tell you what my first thought is again to talk to the community outreach and engagement team at Holden. That is specifically their purpose, is to help researchers who potentially have not thought about the relationship between the basic science that they're doing and outcomes so far down the road for populations, but who understand that if we're going to truly reduce the burden of cancer, we have to think about those outcomes. And the community outreach and engagement team is there to be ushers through that process. It's not straightforward. It's not easy. It's very complicated. But I think if we can get everyone in the Cancer Center committed to thinking about how their research affects community and potentially how community priorities could affect their research, I think we could see a really big shift in outcomes. So I would say start by contacting the community outreach and engagement team, start with a conversation there. And from there, I think deep conversation and commitment is really key.
I would add for the basic scientists that being able to say you did that and describing it briefly in the impact section of a grant is very good for the grant. So it's not only the right thing to do, it's helpful when it comes to trying to get external funding.
And the community outreach and engagement team can help you with that section of the grant. Yeah, it's great.
And Kelly, I would just add, I think it's really important for bench scientists to be seen and introduce themselves, because there's no way that we could ever find you in the depths of the lab. So I think it's just so important to get involved, share your email address, look at the newsletter. I would imagine it would be cool to kind of see like real life examples of like how your work really impacts what's happening.
Absolutely. I completely agree, Rachel. Thank you. I see Brad's question in the chat. Would you like to briefly describe the research priorities that are described in the cancer plan? There is some relevant language in chapter 4, priority 6. Yes, Brad, we would be happy to do that.
I'm just, the reason I brought it up was just to say that the research enterprise in general has been called out as a priority in the cancer plan. And, Dr. Wiener mentioned that, we can use this language for impact statements and grants and things like that. This is good material even for bench scientists.
Thank you. I took it a different direction, but thank you for that.
Yeah, thank you.
Yeah, thanks, Brad. Well, it looks like we're about out of time. So, and we did record this. So if anybody knows anybody that wants to watch this at a later time, we can send out the link. Thanks everybody for joining. And thanks again, Kelly and Rachel, for the great presentation and educating us.
Thanks, everybody.
Have a great weekend. Bye, everyone.